Birth control is something you hear about all the time, but what about emergency contraception? Who needs it? Might you need it? And when will you be able to access it? Stay tuned when we talk all about Plan B and other types of emergency contraception. Welcome back to my channel. I'm Dr. Renita White, a board-certified OBGYN and women's health expert. This is my channel where we talk all about your body and your health, helping you to feel empowered to advocate for yourself in the healthcare setting. Join me every Friday where we talk about a different topic related to your body. And if you don't want to miss a thing, don't forget to like, subscribe, hit the bell, and leave a review so I can know exactly what information you want to know in the comment section. So this week we're talking about emergency contraception. Oftentimes when you hear contraception, you may be thinking about the birth control pill or an IUD, but emergency contraception is something that's available to prevent an unplanned pregnancy without regular use. So who might need it? Well, it literally can happen to anybody. Let's say the condom broke, or you had sex unexpectedly and did not have all the equipment that you needed, like a condom, available. Maybe you were planning on having sex, but then realized after the fact that you had missed your pill or missed your patch, let's say. Or it's even possible that you find out a couple days after you've had sex that your IUD wasn't in the right place. So these things are things that can happen to anybody and can be unexpected. And that's where emergency contraception comes in to help prevent that unplanned pregnancy. Well, what are the types and how can you access them? The three most common types are 2 of them pills and 1 of them is an IUD. So you may have heard of Plan B. Plan B one-step is a type of emergency contraception that is 1 pill of a type of progesterone called levonorgestrel. You take this pill 1 time and it can help to prevent ovulation, to prevent you from getting pregnant. Another option is called Ella, or the generic is ulipristal acetate. This is similar to Plan B one-step, except it's just a different type of pill, but you still take it once and it helps to prevent ovulation as well. Finally, there's the copper IUD. So this is not a pill that you take, but this is that T-shaped device, no hormone in it, so just a little bit of copper. And when inserted in the right timing, it can change the environment of the uterus to prevent an unplanned pregnancy. So how exactly do these things work? Well, with the pills, both Plan B and Ella, as long as you take this pill within a certain time frame, then you're decreasing the risk of ovulation, often by delaying ovulation. So with Plan B, for example, it's recommended that you take it within 72 hours of that unplanned intercourse, which is 3 days. So if the condom's broken or you realize you had that missed pill, then you can get this medication, take this pill once, and as long as you're within that 72-hour window, then you're decreasing the risk of ovulation, many times by delaying when ovulation is going to be. Sperm can sit in the body from anywhere between 3 to 5 days. So even if the sperm is already present in your body, by taking that Plan B and delaying ovulation, then you're decreasing the risk of sperm and egg meeting. Same thing with Ella. So if you take that medicine, you're delaying when that egg is going to be available. So by the time that the egg does ovulate, if it does, then the sperm should hopefully be gone or dead by that time. So Ella and Plan B are similar, but different in regards to the timing. With Plan B one-step, it's recommended that you use it within 72 hours, but with Ella, you can go up to 120 hours, which is 5 days. So if you have had unplanned sex and you can't access something within 3 days, then you may consider using Ella instead in order to get the highest chance of success. So timing for insertion of the copper IUD is similar to Ella. So it is also recommended that if you're going to use it for emergency contraception, that it's placed within the first 5 days after unplanned intercourse. So that's 120 hours after unplanned sex. So how effective are these things? Well, truly the most effective is the copper IUD. It's quoted to be 99.9% effective when it comes to preventing an unplanned pregnancy with emergency contraceptive use. That's really similar to what its effectiveness is regards to regular contraceptive use. Now, what about the other two pills? Ella is found to be about 94% effective, whereas Plan B one step is quoted to be about 87% effective. Now again, the things that play a role with this include when you used it. So are you within the recommended window, time frame where they say that you should use this to prevent an unplanned pregnancy, but also where you are in your cycle. So if you're in the first week of your cycle, which is that week of your period or somewhere within the first 7 days, your risk of actually getting pregnant at baseline is already lower because you're further from ovulation. The effectiveness of these methods can be affected by how close you are to ovulation. So if you are within the first week of your cycle, so that's day 1 through 7, so to speak, of your cycle, you're about a week away from ovulation. So using one of these emergency contraceptive methods is going to be a lot more successful than somebody who was going to ovulate the next day. So no one knows exactly when they're going to ovulate, but you have the highest chance of finding success with these methods if you take it within the right time frame and if you are further away from ovulation. For somebody who was already going to ovulate within 1 day, taking this may not be effective. So that's why it's important to always use a more reliable form of contraception if you feel like you're at high risk for an unplanned pregnancy and if you can plan so. Now these methods can have some side effects, mild but possible. Some people have no side effects at all, but one of the most common side effects are a change in your bleeding. So because we're delaying ovulation, that means we're delaying when your period's gonna come. So your period may be late by a week or 2. You can also get irregular bleeding or spotting that comes about within this time frame of when you take the medicine all the way until your next cycle comes. It's possible to get things like nausea, fatigue, or headaches. Even breast tenderness can happen. But these side effects should be short-lived and usually resolve within a week or 2. There can be limitations to using Plan B, Ella, or IUD insertion for emergency contraception. Well, first things, let's talk access. So luckily, Ella and Plan B are things that you can get over the counter at your local pharmacy, but not every pharmacy may carry it. So you may have to go from pharmacy to find the right one. However, it can be prescribed by your doctor. So if you have a relationship with a provider, you can send them a message and have them send a prescription over to the pharmacy so that you can get access to these medicines. Things like the IUD can be a little bit more tricky because the cost of an IUD is usually over $1,000. So when insurance is used to get access to an IUD, that can take several days for pre-certification processes to happen, and that may push you out of the window of your ability to get an IUD. But you can check in with local clinics or things like Planned Parenthood to see if they have easier access to IUDs. Cost is something to consider. As I mentioned, the IUD can be over $1,000 without insurance. Ella and Plan B tend to range somewhere between $75 to $65. I just went to my local pharmacy just to see what the cost would be there, and it was about $45. So that may be a lot. So these are things to keep in mind when thinking about access to emergency contraception. There are some other limitations to think about. So one thing we do know is that your baseline weight can have an effect on how effective your emergency contraceptive is. Some studies have shown that people who have a BMI over 30 and even more so over 35 may find less effective rates of their Plan B or Ella working. This doesn't mean that you shouldn't try to use this method, but it should be something to keep in mind. We don't exactly know why that's the case, but it is something that's been found in some of the studies. Now, another thing to keep in mind is that emergency contraception is not an abortion. It does not prevent an embryo from implanting or from a pregnancy from taking place. So if you take these methods and you're already pregnant, it will not stop you from being pregnant. These methods prevent ovulation and change the environment of the uterus so that egg and sperm cannot get together to make an embryo. In addition, this is also not intended to be used for regular use. So though it is safe to use Plan B and Ella as many times as you need to, such as every month or every few months, if you find that you're using these methods that regularly, you may want to consider using another method to be more preventive to prevent an unplanned pregnancy. So this could be a regular hormonal pill like the birth control pill, could be Depo or the Nexplanon. The options are endless. But talk to your healthcare provider to figure out what's the right thing for you. Now, it's so good to know that you have options, and Plan B, Ella, IUDs, these could be things to help you if you're in a pinch, if you're ever in a spot that you feel like you're at higher risk for an unplanned pregnancy. If you think that this may be you, talk to your doctor about having a prescription on hand just in case. Know the local pharmacies you can go to get these prescriptions, and make sure that you follow the directions, using it within the appropriate guidelines that are listed, either within 72 hours or within 120 hours. That's in 3 days or 5 days. You can use this as often as you need, so you can't use it too much. And even if you have the little side effects we talked about, like breast tenderness, irregular bleeding, they should be short-lived. Hopefully this is helpful for you. Stay tuned for another episode next week. See you then.